This video illustrates the endoscopic anatomy of the sinonasal cavity, focusing on key landmarks essential for scalp-based neurosurgery. We begin by entering the right nasal cavity and advancing along the nasal floor. We first identify the inferior and middle turbinates. The middle meatus, located between these turbinates, reveal the uncinate process. We then medialize the inferior turbinate to access the inferior meatus, where the nasolacrimal duct opens near a fold of mucosa known as the Messner valve. 0 degrees endoscope is then passed between the inferior turbinate and the septum, and about 1 centimeter behind the turbinate's posterior edge, we find the Eustachian tube and the rosimular fossa, which outlines the lateral nasopharyngeal space. Now, returning to the middle meatus, mobilize the middle turbinate, and we can observe the hiatus semilunaris, a curved groove between the uncinate and the bulla. And at its base lies the maxillary ostium, which opens into the maxillary sinus. See here, for reference, the anatomical relation between the bulla and the maxillary sinus. As we follow the posterior end of the middle turbinate, we align with the choana, and just above this area lies the Woodward plexus, and crossing this Woodward plexus is going to be the sphenopalatine artery. Now, tilting the endoscope upward, we identify the superior turbinate and middle to it the sphenoidal recess where the sphenoid ostium is located. A through cut is used to remove the middle turbinate, exposing its 3 attachments: the superior attachment to the cribriform plate, the middle attachment or ground lamella in the coronal plane, and the posterior attachment in the axial plane. An oncinectomy is then performed to expose the bulla ethmoidalis, the bulla, the superior turbinate, and adjacent ethmoid mucosa are removed using pituitary Ronger's. The maxillary ostium is now widened using a backbiter, completing this way a medial maxillectomy to improve access to the lateral spaces. Now we move the endoscope through the ostium sphenoidale, and inside the sphenoidal sinus we identify midline landmarks such as the clival recess, sella, tuberculum sella, and planum sphenoidale. Laterally, we find the lateral optico-carotid recess, a consistent bony landmark that guides identification of the optic nerve and internal carotid artery. This recess corresponds to the optic strut. And middle to that, behind the carotid's anterior band, the middle clinic process marks the origin of the corticochlear ligament and the roof of the cavernous sinus. We now then repeat the same approach on the left side. The inferior and middle turbinates are identified, and the inferior meatus is examined for the lacrimal duct. The middle turbinate is then mobilized to access the uncinate process and bulla. Posteriorly, behind the middle turbinate, we see the roof of the choana, and behind the inferior turbinate, the Eustachian tube. Tilting the endoscope outward again, we locate the sphenoid ostium behind the superior turbinate. Now we're going to turn our attention to the middle turbinectomy on the left. So the middle turbinate is resected here using a through cut. This is followed by oncinectomy and removal of the bulla ethmoidalis. This process completes the middle maxillectomy and anterior and posterior ethmoidectomies. See how the mucosa of the sphenoid sinus is now removed, same as the superior turbinate. to further increase the access to the sphenoid sinus. Now here with the 30 degrees scopes, we can see the relation between the posterior wall of the maxillary sinus, the orbit, and the sphenoid sinus. Now we are moving our endoscope into the right side, and we're going to raise a nasal septal flap. This is a start posteriorly with the superior cut just 1 centimeter below the roof of the nasal cavity to avoid injury of the olfactory fibers. And the inferior cut is carried down all the way to the level of the inferior turbinate at the level of the floor, and then a freer or a caudal elevator is used to raise the flap backward all the way towards the woodruff plexus. Thank you for your attention. Wait for more, and a special kudos to our fellow Marcus Ruiz for his outstanding dissections.